Cool.
Okay. Hi, who are you?
Nathan, you, CDC.
Okay, my question was, when you were talking about having your subscribers and then when there was a specific disaster, being able to reach out to them, how much information do you have about them? Like, do you know what region they're from?
We can narrow down by state, we can narrow down by zip code, and we've actually tried that before with earlier hurricanes, like with Dolly, which came down the South Texas coast. But we actually have found, and we've learned this with several other channels, not just social media channels, but with other channels that our emergency communication team at CDC uses, that most of our audiences don't really want to be restricted to just localized information. The people who are signing up for their Hurricane Tip of the Week, regardless of what section of the Gulf Coast or the Atlantic Coast they're on, actually want to receive these messages that are relevant to the current storm, even if they're not in that area. So we have not been narrowing them down by zip code in the last hurricane season. So folks on the on the Florida coast were receiving messages about Ike, even though they weren't in the affected area, because those messages actually, I mean, you were talking about some brief messages, but they're updates about the current storm, and they're actionable messages about taking preparedness steps. So they're not things that aren't relevant to people who are in hurricane areas. These are people who are signed up for hurricane preparedness messages because they are in hurricane regions in the first place. They're not people who are sitting in Nebraska and don't care about hurricane preparedness.
Okay.
So they're relevant messages, health messages that we think they can all use. And we don't see a big drop off because people are still receiving these messages.
Right.
So yeah, even though we can regionalize them and narrow them down, when we have done that in the past, not just for social media channels, but with other channels, we've actually gotten complaints from people for doing that. So it's been really interesting to see that. So we stopped restricting